G'day, Dr. Phil from Bodyline Health. Today I'd like to talk to you about something that's going to happen to most people. They say statistically 80% of people have back pain at some stage in their life. And the conversation I had with one of my patients today revolves around a story I've heard probably on a monthly basis for the last 20 years. She simply bent over to pick something up, this was last week, had a spasm, excruciating pain, had to call an ambulance and was taken into hospital. And a lot of people, she didn't even have MRIs. Basically, a lot of people, when you go to the hospital, they send you home with some painkillers and some Valium, a muscle relaxant. And it's quite hard and difficult for people to appreciate or, I guess, understand why they almost feel dismissed and sent home. And what I've learned and what I have to, I guess, explain to her is you've got to ask a lot of questions around what happened the days leading up to the incident. Often the incident where you're bending over, picking up something, or doing your shoelaces and it sets the back off, brushing your teeth. It's happened to a lot of my patients doing their hair. They can have major back spasms, extremely painful, extremely scary, but it's what you've been doing the few days before. So in this incident with the patient this morning, she'd been packing to move house. So a lot of heavy lifting, twisting, bending, things that her body wasn't used to. That's what caused the fatigue, caused the slight inflammation in her back that her body wasn't able to clear up in time. And then when she woke up next day, bent over, bang, that's what caused the spasm. So as scary as it can be, one really important thing I want you to take home from this is that if you are doing something new or different that your body's not used to, like moving house, painting, doing something that your body's not used to, that is when you're most likely or most susceptible to injury. So always try and plan and think around it. That's where doing the normal exercises, stretching beforehand, or more importantly, maybe staggering the amount of time that you're doing things for. If your body's not used to it, don't go do 2 hours of it. Maybe do half-hour blocks. Give yourself a chance to recover so that you can hopefully avoid these scary incidents where the next day you go to pick up a child and you set your back off. So that's my main words of advice. If you've ever experienced this before and need to talk about it, give us a call, leave a message. Bodyline Health. Thank you.